Hello everyone, I'm Dr. Ayushi, pain, musculoskeletal medicine and rehabilitation specialist. And today I want to talk about back pain. In my clinical practice, I come across a wide range of patients having back pain, beginning from a young chap, doing his desk job for long hours, to a player, to a elderly person who's like having a big abdomen and sitting and doing the bad spinal posture. So these are the usual causes of back pain. When our postures are not right, when we are not doing the right exercises, when we are not taking care of our movement and we are keeping ourselves like we are sitting for longest duration and an abnormal posture. So all of these things culminate into something called as back pain. And when this pressure over the back gets translated onto your vertebral column, there is something known as disc herniation or disc bulge, which is very common. We must have heard our friends talking about sciatica or pain radiating from back to the foot down the neck. So this is what happens when there is a disc extrusion or disc bulge, which impinges onto the thecal sac in the spinal cord, exerting the pressure, sometimes even blocking the exiting nerve roots. And that's when we start feeling pain in that particular limb in which the exiting nerve root is being blocked. So how do we deal with back pain? In my practice, we follow a very systematic approach when I am treating a patient with back pain. So we begin with proper examination, clinical examination of the patient, doing certain specific tests like straight neck raising test, slump test, and there are so many specific tests that give us an idea about the kind of problem that particular patient is facing. Then meticulously study the MRI of the patient to understand the kind of problems within the vertebral column and the spinal cord is there, ranging from if there is any fascicle joint arthropathy, is there any ligamentum flavum hypertrophy, or which side of the exiting nerve root is getting blocked, is it right, is it left, whether it is a posterior central or a lateral bulge. So that depending on that particular study, a meticulous study of the patient by clinical examination and of the MRI to understand the inherent pathology of the patient, help us and enable us to come down to a very comprehensive treatment protocol. So we begin with the medical management by giving the centrally acting muscle relaxants, non-steroidal anti-inflammatory drugs, and a very focused physiotherapy, starting with a Wales regime, which is also called as a flexion regime to start with, and then progressing to the McKenzie, that is the extension regime. So that's how we increase and we decide at what stage what kind of exercise has to be followed and how dedicated and what ranges are to be followed when it comes to the conservative management. So if the pain is excruciating, if the pain is so much so that the patient is not able to do the exercises, not carry the usual daily work that the patient is supposed to do and is happening in natural or daily life, we don't jump straight to the surgery. We follow a minimum invasive from conservative to a minimum invasive treatment protocol in which we do CM guided blocks, now which also very meticulously depends on your pathology, your problem in the spine and what you're feeling. We go very specific that whether we want to do a left-sided transforamen root block or we want to do a faceting block for the arthropathy, or we want to go for an interlaminar block for diffuse disc bulge. So it is a very meticulous planning depending on the condition and the symptoms of the patient. We do a minimum invasive CM guided nerve blocks, which give us that window of painlessness as well as freedom for the patient so that he can work towards strengthening the muscles and catching or walking on the path which can avert that surgery. But when it comes to surgery, there are certain red flag signs that we shall not ignore. We shall not ignore them and not go for the conservative or minimum invasive treatments, but shall follow the path of surgery. So those red flag signs include any weakness in the limb. There is a weakness, you're not able to lift up your limb or your neck or your hand, and the weakness has increased to that level. or there is so much pain that you're not being able to do anything in your life. It is hampering everything and anything. The pain is with the pain such a pain of excruciating quality. Then there is something called as if there is any loss of bowel and bladder control. If you feel that you're not able to pull your urine or you're not able to urinate. So all of these are the red flag signs which point towards that now we cannot do any conservative or minimum invasive treatment, and he shall go for something more invasive in terms of surgical management. It can be discectomy, it can be discectomy with fusion. So there are multiple approaches if we have to do, we do laminectomy. But good thing about purple add-on is that whatever surgeries that we do in the spinal cord or in the vertebral column are all under the microscope. So this microscope gives us the freedom of precision, of going very near to the very sophisticated structures. And if we are doing discectomy and if we don't clear the entire disc, the symptoms will not go. I have come across many patients in my practice who, even after operation, complain of the same thing, that they're still feeling the pain, they're still feeling the radiation, they're still feeling some weakness in their limbs. It's only because if we don't have a sophisticated technology, we cannot go very near to the structures as sophisticated as spinal cord. So we need technology, we need that kind of vision, and with that kind of freedom when we are operating in a canal, in a small structure like spinal cord. And that's when these microscopes, super microscope, help us to go really near to the structure with a precision and freedom of safety and work out the best possible outcome for our patient. So that's a very holistic protocol, and after that we follow a very comprehensive rehabilitation, including the spinal orthosis, physical modalities, proper physiotherapy, ergonomic management. We tell you how to sit, how to walk, what to wear in the footwear, because we can shift the body weight to the anterior metatarsal bone and relieve the low back. So all of these managements come along and work along with the other medical management that we are doing, and that's why we are very holistic in the way we treat our patients when it comes to low back pain. I wish all of you to take care of yourselves and your back, keep your postures right, sit straight, squeeze your muscles. If you have to do a job when you have to sit for longer durations, take small breaks, walk after every half an hour, stretch yourselves, do exercises, stay active, stay healthy. Thank you.